Hello, my name is Stephen Hale. I'm the Senior Benefits Consultant in the Human Resources Department, and this presentation will cover open enrollment for 2021. We'll go over the changes that are happening for your upcoming benefit elections. So open enrollment this year will be an abbreviated time frame. It'll be from October 15th through October 31st. Please don't wait until the last day to try to complete your enrollment. As we know from past years, those people who wait until the last minute always run into some issues. The phone lines always become very congested, and we want to make sure that you get it done early enough in order to get your benefits done without any issues. As in years past, everyone must touch your health insurance election. You will be automatically put into the 70-30 plan, and you will need to opt out of it to be in the 70-30 plan, and you will need to complete the tobacco attestation in order to save $60 off the monthly premiums. As with years past, you will have to make a new flexible spending election because those are an annual benefit. So again, enrollment this year will be through the single sign-on option found on the HR website, or you will be able to call the Eligibility and Enrollment Call Center at 1-855-859-0966. They have hours Monday through Friday from 8 a.m. to 10 p.m. and Saturdays from 8 to 5 p.m. We will not be holding enrollment labs as we have done in the past, and that's due to the requirements for social distancing. So please keep in mind the two ways to enroll in 2021 will be completing it yourself through the single sign-on option on the HR website or by calling the Eligibility and Enrollment number. We're going to start by looking at the changes with the state health plan. As a reminder, all members will be moved to the 70-30 plan effective January 1st, 2020. You'll see that change when you log into the eBenefits portal in October. Employees must take action. If you want to be in the 80-20 plan, you will have to elect out of the 70-30 and enroll in the 80-20 plan. You'll also need to take action if you want to reduce your premium for both the 70-30 and the 80-20 plan. Failure to take action by October 31st will result in you remaining in the 70-30 plan and paying higher premiums because you have failed to complete the tobacco attestation. You could also pay higher co-pays for your primary care provider office visits. So please take some action. The good news is the premiums for 2021 have not changed. They will remain the same as they were in 2020. So you can see the rates there for each of the plans, the 80-20 and the 70-30 plan. You can get a reduced premium if you complete the tobacco attestation. As a reminder, our health insurance premiums are collected a month in advance. So if you change plans or increase or decrease your level of coverage, you'll see those new premiums take effect in the December payroll. That's just something we'd like to remind you of. The tobacco attestation process has changed for 2021. Hopefully you've already gotten some mailings from the state if you are currently enrolled in the state health plan. They started mailing these notices out in July. So employees who are smokers could have completed the tobacco attestation starting in July, and you'll have them through November 30th to complete the process. So this year, they've added a second option for you. You can still go to a CVS Minute Clinic and speak with a pharmacist, or you can go visit your primary care provider and have a free wellness visit. So there are two ways for you to complete the tobacco attestation. This will give you more time to complete it. And the state wants to make sure that you are doing everything they can in order to help you save the $60. You have until November 30th to complete this tobacco attestation. Right, so again, new for 2020, Subscribers can attend a tobacco attestation counseling session for free at either a CVS Minute Clinic or a primary care provider's office. By doing so, you will save $60 off the premiums in 2021. You can start that now. Because you can now see your primary care provider, there will be no waivers if you can't get to a CVS Minute Clinic within 25 miles of your home. So there's no longer a waiver for getting that wellness credit. To earn the $60 premium credit, you will have to complete the tobacco attestation by November 30th. You don't have to wait until open enrollment or do it during open enrollment. You have until November 30th. If you visit the CVS Minute Clinic, it is suggested that you hold on to your patient visit receipt or the after visit summary. This is because we want to be able to have proof that you've completed it, and if for some reason you don't receive the tobacco cessation credit, attestation credit, you'll have some kind of documentation showing that you visited the CVS. So please hold on to your receipt if you visit a CVS Minute Clinic. You can always complete this tobacco attestation throughout the year. You can go to any CVS Minute Clinic or visit your primary care provider's office. You'll only receive the tobacco attestation credit if you do so by November 30th of this year. If you do it throughout 2021, the tobacco attestation credit will not be received until 2022, right? So you must do this by November 30th in order to receive the credit for 2021. Also new in 2021, members who select a clear pricing project primary care provider could reduce their office copays to $0. That's free. Right? So Clear Pricing Project is a new incentive by the state. They have provided this designation to a whole host of new primary care providers. So a Clear Pricing Project primary care provider's name must appear on your ID card in order to get the $0 copay. If you select a primary care provider that is not in the Clear Pricing Project network, but you still have a primary care provider listed on your ID card, the copays for office visit will be $10 for the 80/20 plan or $30 for the 70/30 plan. If you see any other primary care providers other than the one listed on your ID card, the copays will be $25 under the 80/20 plan or $45 for the 70/30 plan. If you visit a primary care if you visit a Clear Pricing Project specialist, you can also have a reduced copay depending on which plan you're under. If you're under the 80/20 plan, the copay for a Clear Pricing Project specialist is $40. All other specialists under that plan will be $80. For the 70/30 plan option, if you visit a Clear Pricing Project specialist, the copay is $47. All other specialists will be covered at the $94 copay. Why do you see the Clear Pricing Project primary care providers and specialist offers? These providers believe in affordability and transparency, and the state health plan has chosen to provide incentives to members who visit these providers. Again, these copay reductions are applicable to both the 70/30 and the 80/20 plan. This screen is just showing you, again, the copays under each plan. If you see a Clear Pricing Project primary care provider and have them listed on your ID card, the copays are $0 under both plans. If you see a non-Clear Pricing Project primary care provider, the copay is $10 under the 80/20 plan if that individual is listed on your ID card. For the 70/30 plan, the copay is $30. Any other primary care provider is going to be $25 under the 80/20 plan or $45 under the 70/30 plan. A Clear Pricing Project specialist under the 80/20 plan will be $40. All other specialists under the 80/20 plan will be $80. Clear Pricing Project Specialist under the 70/30 plan will be a $47 office copay. All other specialists will be $94. And then you can see there are reduced primary Clear Pricing Project provider copays for speech, occupational therapy, chiropractic, and physical therapy. So those copays are listed there on your screen. So if you see a Clear Pricing Project provider, you can save money on your office copays. How do you know who is in the Clear Pricing Project network? You can go to the State Health Plan's website, click on a Find a Doctor link at the top of the page, then select the plan that you're under, the 70/30 or the 80/20 plan, and it will take you to the Blue Cross Blue Shield network, where you will search for the plan you're under. We are covered by the the North Carolina State Health Plan. Select that plan, and it will take you to Find a Doctor link, and as you go through all the lists of providers, you'll see doctors that have the Clear Pricing Project designation, right? Also, if you go to the State Health Plan's website, you can click on the Clear Pricing Project Provider search tool. It will take you to an option of 3 different regions. We're currently, if you're in the Greensboro area, covered under the Piedmont region. And if you click that, a whole list of providers and offices will be listed there. You can use the search engine to find your doctor's office, your doctor's name, the city that you're in. You can find a list of primary care providers in the Clear Pricing Project. So there's a couple of different ways for you to find out who is in the Clear Pricing Project network. Again, you will save office copays by receiving lower copays if you have a Clear Pricing Project provider listed on your ID card. Also, under the State Health Plan, the only other change to the plan is beginning in January of 2021, preferred and non-preferred insulin copays have been reduced to $0. So insulin is now covered at no cost under both plans. As a reminder, this prescription formulary or the drug list of covered medications changes quarterly throughout the year. So changes to the drug coverage can happen under both plans at any time during the year. So you want to go on to the CVS Pharmacy Resource Center and search through the lookup tools there and see where your prescriptions currently fall. What may have been on tier 2 could now be on tier 1. What was on tier 2 could be on tier 3. Again, this list of prescriptions changes on a quarterly basis. So you want to make sure if you take a prescription on a regular basis that you're going to the lookup tools and seeing where your prescriptions fall. During open enrollment, annual enrollment, you can add or remove dependents without a qualifying life event. So you can add or remove dependents. You can change plans during your annual enrollment period as well. If you add or remove a dependent, great. If you're adding somebody who has not been covered by the state health plan in the past, you will be required to provide documentation showing that the dependent's eligible to be added to the state health plan. Moving on to the NC Flex benefits. If you do not enroll during open enrollment, your current NC Flex benefits will roll over with the exception of the flexible spending accounts. Flexible spending account elections for both the healthcare flexible spending account and the daycare flexible spending account must be made each year because it has a new annual election. So each year you must make your new election for the flexible spending accounts. In 2020, any participant in the flexible spending, the healthcare flexible spending account will be able to roll over $550 into the 2021 plan year. That's an increase of $50 than what was originally planned for in the 2020 year, and that's due to the COVID response. So they've increased the amount that you can roll over into the plan year of 2021. Again, you must make a new election each year. For the healthcare flexible spending account, the minimum is $120, and in 2021, the maximum will be $2,750. As a reminder, you can use your flexible spending account for out-of-pocket medical, dental, and vision expenses for you and your entire family, whether or not you cover them on your health, dental, or vision plan. This is a standalone plan, so it is not connected to your other benefit plans. So if you have a spouse who is working, you can both elect the maximum allowed under each employer. So for the state, the maximum is $2,750 for the 2021 plan year. At the end of the year, the use it or lose it rule will still apply, but you can roll over between $25 and $550 for the 2022 plan year. So that use it or lose it rule is softened by allowing you to roll over up to $550. Anything over $550 at the end of the year could be lost if you can't submit a claim against it. For the dependent daycare flexible spending account, again, you're setting aside pre-tax contributions into a flexible spending account that will pay for out-of-pocket daycare expenses for children under the age of 13 or adults that live with you at least 8 hours a day. The minimum you could set aside is $120. The maximum is $5,000. But this is a household maximum, so you do have to coordinate your annual election with a spouse if their employer allows them to contribute to a daycare flexible spending account. Just like the healthcare flexible spending account, there is a use it or lose it element to this plan, but it does not have a rollover feature. Instead, the daycare flexible spending account has a 2.5-month extension that allows you to incur an expense and submit it against your 2021 balance through March 15 of 2022. The dental benefit in 2021 will see reduced premiums. So on the screen, you will see the 3 different plans. There's a low option, a classic, and a high option. And then there's 4 different levels of coverage: employee only, employee plus spouse, employee children, and employee plus family. And these are the new 2021 rates for the dental plan offered through MetLife. The average savings will be between $1.50 through $9, depending on your level of coverage. So everybody will see a reduction of some kind on your dental plan. The plan itself hasn't changed between 2020 and 2021. Here's the details of the plan. Again, you can see that the high option has a $50 deductible per plan year per covered individual for the first 3 people under the plan. The classic and the low option have a $25 annual deductible per person per plan year for the first 3 people under the plan. The maximum benefit is $5,000 under the high option, $1,500 for the classic option, and $1,000 under the low option. The low option still does not provide any coverage for crowns or bridges or orthodontic coverage. That benefit is only available to the classic and the high option, and there's some limitations there. The other NC Flex benefits. So for the cancer plan, you can enroll in, or if you're currently enrolled, you can increase your coverage without providing an evidence of insurability form for 2021. If you're currently covered under the cancer plan, this is your friendly reminder to file your annual wellness claim. Each year you can receive between $25 or $100, depending on your level of coverage, for maintaining some preventative services like mammograms, pap smear. If you go for your lipid test for your cholesterol screening, there's a blood test or a prostate cancer screening. Check your enrollment guide that will be sent to you. There's a whole list of preventative services that will qualify for that wellness credit. So please take advantage of that incentive. Also, if you're currently not covered by the Voya term life insurance offer through NC Flex, you may purchase up to $20,000 or If you're currently covered, you can increase your coverage by $10,000 or $20,000 without an evidence of insurance-ability form. Anything over $20,000, if you're new or increasing your coverage by that amount, will require you to complete an EOI, which will be mailed to your home. So please watch for that in the mail. There are no changes to the accident plan, the vision, the critical illness, or the accidental death and dismemberment plan. As a friendly reminder, there is a $10,000 core accidental death and dismemberment policy that is free. Please make sure you are enrolled in that benefit. How do you enroll in your benefits? It's still through the e-benefits portal. Right. When you go to the e-benefits portal, this is this self-service portal for you to go in and make your elections each year through open enrollment, but it's also where you can go in and make your qualifying life event changes. So if you've had a baby, or if you've gotten married, or if you have a spouse who loses or gains employment, those are all reasons for a qualifying life event that would allow you to make changes during the plan year. During open enrollment, again, you can go in and make changes as well. This screenshot is of my e-benefits portal. When you log in, you'll see something very similar to this. On the left-hand side, you'll see the manager account. That's where you can go in and update your primary care provider at any time during the year. Above manage your account is your profile. During open enrollment, I'm going to suggest later on that you will check your name and address, and that's where you'll find the profile link above manage your accounts. In the bottom left-hand corner of the screen, you'll see quick links. These are the benefits that I'm enrolled in. You'll see I have the state health plan, so there's a Blue Connect link and a CVS Caremark link. I have a flexible spending account. I have the iMed vision coverage and the MetLife dental coverage. I have already gone into these plans and have registered, created an ID and a password. Great. Because I've done that, I can now go into the e-benefits portal, and using one of these quick links, using my UNCG credentials, click this link and it will automatically open up. I do not have to remember the ID and passwords associated with these accounts. Because I've already registered once, these quick links will automatically open with my UNCG credentials. So that's going to save you some time and a headache in the future. So that's just a nice little trick that we want to remind people of. So to complete a successful enrollment, make sure that when you log into the e-benefits portal that you were going to update, verify your contact information in your profile. Make sure your phone number and your email are correct. Make sure your mailing address is correct, because that's where ID cards will be sent. Enter and update your dependent information, including the date of birth and the social security number for each dependent. You will need social security number and date of birth for your dependents if you're going to cover them on any of your other benefits. So make sure you have that information beforehand. If you update your dependent information at the beginning of the e-benefits enrollment process, during the enrollment process, whenever you want to add a dependent or a beneficiary, you'll simply select from a list of dependents that you've already provided. Review, add, and update your beneficiaries for your term life insurance policies, your accidental death and dismemberment policies, critical illness, and your cancer plan as needed. Excuse me. Once you've completed the enrollment process, make sure you print a confirmation statement so that you'll have evidence of your elections. If you do not have the ability to print your confirmation, once you've completed the process, you can email us at Ask Benefits, and we will send you a copy of your confirmation statement so that we can make sure that you've done it correctly. There is one new benefit that I want to touch base on, and that's a MetLife policy. UNCG and several of the other UNC institutions are partnering with the UNC System Office to consolidate our voluntary after-tax life insurance plans. We currently do offer a supplemental life insurance policy offered through MetLife to our members here at UNCG. So we are consolidating this plan with others, and what that has done, it's enhanced the coverage that's available, increased the benefit options, and lowered the cost of this benefit. So new in 2021, the plan will offer voluntary retiree options starting at $25,000. Additional coverage is available, but anything over $25,000 will require an evidence of insurability form. New coverage amounts will be between 1 and 8 times your salary, up to a maximum of $1 million, whichever is less. Dependent children coverage is available from birth up to age 26, as long as the dependent remains unmarried and is supported by you. Excuse me. You can increase your current coverage amount by 1 times your salary up to $500,000 without providing an evidence of insurability form during open enrollment. So between October 15th and October 31st, you'll be able to increase your current election by 1 times your salary. Beginning in 2021, if you have your spouse covered under the plan, their coverage is now portable, which is a nice benefit. All dependent children enrolled in this plan will be covered at the $10,000 level of coverage. There are new services such as estate resolutions, funeral assistance, transition solutions, and digital record storage, which are now available under the new plan as well. So what do you need to do? If you're already covered by the MetLife Supplemental Voluntary Life Insurance, the coverage amounts you currently have will remain the same unless you take action. And again, you can increase it by 1 times your salary without providing evidence of insurability. During the open enrollment period, PDF versions of the MetLife information, such as enrollment forms, rate sheets, etc., will be emailed to the campus. We will also have them available on our website. Employees are always welcome to request a packet of the information directly from benefits@uncg.edu. During open enrollment, you can make changes to your benefit coverage. We recommend that you carefully review your current life insurance and accidental death options to determine if you need to change or cancel other coverage that may be available based on the coverage that is now being offered through the new voluntary life insurance and accidental death dismemberment policy through MetLife. So really look at all of your benefits to see which option is most cost effective and the right choice for you. That is the overview of our 2021 open enrollment process. Please feel free to reach out to the HR benefits team at askbenefits@uncg.edu if you have any questions. We are here to help you. Again, I'm just going to remind you to reach out to the Eligibility and Enrollment Call Center at 855-859-0966 if you are not comfortable in completing the online enrollment online. That will be available to you.